Good morning, everybody. It's Dr. Galvin with another post-night shift COVID update. Haven't worked in about 2 weeks, and boy, what a difference a couple weeks makes. The first 5 patients I saw last night all had COVID. All 4 of them were unimmunized. 1 of them was immunized. 4 of them were really, really sick. 1 of them had cold symptoms, and you can guess which one had the cold symptoms. It was the young girl that had been immunized. I want to kind of start off by addressing a comment that Chad had made on our Facebook page about me sort of playing down people's concerns about the vaccine, and I accept that. I own up to that. Given my personal experience and having seen so much devastation from the virus. And also understanding the math behind it, I do tend to downplay concerns about the vaccine, and I own that. And people have legitimate concerns, and I agree. But I think when we really look at the numbers, 615,000 deaths from COVID in the last year, versus really just only a handful of deaths related to the vaccine. I think 3 clearly linked to the J&J from clots. Remember, the VAERS database, which people are misusing left and right, is not a database that says these people have been hurt by the vaccine. It's a database that says that these people have reported things after being vaccinated. Now, remember, 161 million people in this country, almost half of us, have had the full course of vaccination. Every year in the U.S., about 3 million people die. So in the last 6 months, we would expect that that about 1.5 million people will have died just from using normal numbers. If half the population has been immunized, then about 750,000 immunized people will have probably died out of that 161 million. Did those 750,000 deaths occur because of the vaccine? No, of course not. They're just coincidental. People got vaccinated and then they died of whatever cause. And so the VAERS database is a way of sort of looking at that, and then you can mine that data. And when things pop out unusual, for example, the unusual clots in young people that were related to the J&J vaccine, there were 32 cases that were found out of 20 million vaccinations, but it was because of the database that they found it. The database does not, however, is not causally linked, because those case reports are put out by anybody. So the anti-vax people, they're using these numbers, 6,000, deaths reported to the database. Well, let's just, for the sake, it's not true, but let's just for the sake of argument say that indeed 6,000 people have died from vaccination out of, again, we've given 350 million doses in the US. And so on a percentage basis, that's, I think, 0.00018%. As a percentage basis of the people that have gotten COVID in the US, the mortality rate is 1.8%. So it's something like, 1,000, or 1,000 plus times more deadly than vaccine, even if we were to use the VAERS data, which again is being misquoted. That's not what it says at all. But again, the risk is exceptionally low, and we also know that the risk of getting long-term symptoms or having a really severe case is pretty high. Are there treatments? Ivermectin has been tossed around. I'm looking at the studies. I do prescribe ivermectin for people that have severe COVID because I don't think that there's any harm in it, and I think there's a potential benefit. There's a few groups out there that are, suggesting regimens of drugs that are, 5-6 different things that probably cost $1,000 to do. The way I look at it is this: it's like, it's like saying I'm not going to wear a seatbelt because, general surgeons are really good at fixing traumatic injuries, or orthopedic surgeons are really good at fixing bones. Yeah, they are, but it would be better not to have the internal injuries or break the bones. And so the vaccine is kind of like a seatbelt. It's going to prevent you from getting those more severe things. And yeah, you get it. We can treat them maybe. You're rolling the dice though. And so I'm going to continue to advocate for vaccines because, again, they've been proven now to be safe and effective. But I don't, if you have a problem with the vaccine, listen, it's your choice. And I apologize for belittling that if I have. But just understand that you've got to be absolutely careful. Remember, Delta can be spread very, very quickly. A few minutes in contact with somebody that's got it. So if you're unimmunized, you've got to isolate yourself. The fact of the matter is that if you are unimmunized, you're likely going to get Delta because it's just so contagious. It's approaching, it's almost as contagious as measles, and measles is the most contagious virus that we know of. The question about natural immunity versus vaccine immunity, we know that natural immunity generally is better. However, that natural immunity might be to alpha, and we don't know about natural immunity to Delta and other variants. There definitely have been breakthrough cases, many reported, of people have had, breakthrough cases that had developed COVID immunity naturally, just like we're seeing breakthrough cases in people that have COVID or have immunity from vaccines. I think the numbers are scary. I mean, I'm personally seeing it in the department, but just in North Carolina on this 26th of June, we had 324 patients admitted statewide for COVID, and that day we had 55 positive COVID tests statewide. 723, we had 817 admitted and 2,000 positive tests. So that's, markedly going up. Chad also asked about what I thought about mandatory vaccines, and I don't think that vaccines should be made mandatory. However, in the healthcare setting, I think that discussion, and locally in North Carolina, every major health system has made vaccines mandatory just this week. There's a lot of people that do not feel good about that. I understand, but I also, as a provider, we've got a Delta variant that's very, very contagious, and we need to protect our patients, and we've got to protect our staff from spreading those to other people. And so that decision was not made lightly, but I do understand it, and I understand people are going to have an issue with it, and if they have an issue with it, they don't have to work at the hospital. But I think the hospital systems have looked at it from a pretty detailed way. They looked at it before in the spring and decided not to mandate vaccination, but Delta has changed things. It's so contagious and it's so dangerous that they've now made it mandatory. And I'm immunized. I got my first immunization Christmas Eve. Most people I know that work in the acute care settings have it. If they don't, then that's their choice, but the hospital does have the right to sort of say, well, we're not going to let you put other people at risk. You can't work here. And, I think that sucks. But again, I understand both sides of it, and the data is pretty scary. So anyway, that's it. I'm exhausted. It was a long night. And then to add insult to injury, our computer system was down for 5 hours, which means that we're back to paper and total chaos. But anyway, I'm back tonight. I'll do another update after the end of the weekend. But again, I'm Dr. Galvin. Been doing these updates for a while. Please follow us and like us on Facebook and YouTube. And I'll be back. Stay safe. Wash your hands. Wear masks, especially if you're not immunized. Look out for those around you. Look out for yourselves. Look out for your families. I'll talk to you soon. Good night.